Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Today we have some multiple choice question on CIN and cervical screening, and I have a previous two lecture about cervical cancer screening and the colposcopy, so please apply this multiple choice question on the previous lecture and try to answer before me, please. So this is this video containing 10 questions, okay? Each one mark. So please try to answer before me and give yourself score out of 10 and write your score on a comment at the end, okay? So take it seriously and try to answer before me, okay? And tell me your score on a comment at the end. Okay, so choose the one best response. Let us start with the first question. What is the most common cause of cervical cancer? What is the most common cause of cervical cancer? A. Human papillomavirus. B. Radiation exposure. C. Cytomegalovirus. Contraception pills. E. Herpes simplex virus. Choose the one best response. So, the most common cause of cervical cancer is human papillomavirus. Of course, this is the best one response. Okay, let us go to the next question. Who should be screened for cervical cancer? A. All girls at the age of 14. B. Women above the age of 60. C. Women below the age of 21. D. Women at the age between 21 and 65. E. Both girls and adult women. Please choose the one best response and try to answer before me. As I said before, who should be screened for cervical cancer? Which age group? The best one response here is women at the age of 21 up to 65 years. So the answer is D. Okay, let us go to the next question. A 37-year-old woman, force gravida force para, presented with cervical pap smear report of high-grade squamous intraepithelial lesion. Colposcopy with biopsy was performed, and the histopathological result revealed CIN3. What is the next step in management? Again, a 37-year-old woman, force gravida force para, presented with cervical pap smear report of high-grade squamous intraepithelial lesion. Colposcopy with biopsy was performed, and the histopathological result revealed CIN3. What is the next step in management? A. LEAP. LEAP is the abbreviation of loop electrosurgical excision procedure. So A. LEAP. B. Hysterectomy. C. Cold knife conization. D. Cryotherapy. E. Diathermic coagulation. Okay, please choose the one best response and try to answer before me. Okay, everybody, the best one response here is LEAP. So A is the right answer. What is LEAP? As I said, loop electrosurgical excision procedure. Why I didn't choose hysterectomy? Because it is a major surgery. I'm not in need for this major surgery. It is not a recurrent CIN3 or persistent CIN3 and follow-up. So LEAP is quite enough. Why I didn't choose cold knife conization? Cold knife conization needs an operative theater and anesthesia, and it is a bloody operation. So LEEP is its advantage that there is no blood loss, can be done easily under local anesthesia. Okay, so LEEP is the most suitable. Cryotherapy and thermic coagulation may be not enough, because in LEEP we do excision for all transformation zone. Okay, so LEEP is the best treatment in such case. Okay, so let us go to the next. What is the method used for cervical cancer screening? What is the method used for cervical cancer screening? A. Transvaginal ultrasound. B. CT scan. C. MRI. D. Pap test. E. Cold knife conization. Please choose the one best response and try to answer before me. The best one response, of course, Pap test. So D, the answer is D, Pap test, papalicular smear test, okay? Or cervical cytology test, or smear test, or Pap test, okay? So this is common worldwide. It is done in screening program in all developed countries. Go to the next. Which one of the following is true about the cervical cancer? Which one of the following is true about the cervical cancer? A. Worldwide, it is the most common malignancy in women. B. Most cases occur in the developing world. C. It is the most commonly diagnosed in the second decade of life. D. More common in women above the age of 60. Please choose the one best response. Okay, the best one response here, that most cases occur in the developing world or developing countries. Okay, because it is not in the second decade of life, it is not common in second decade of life, it is not most commonly diagnosed in second, and also it is not common above the age of 60. Okay, and now it is not worldwide the most common malignancy due to screening program for cervical cancer, reducing the cases with cervical carcinoma, because we discover the precancerous lesion CIN and manage it properly. That's why cervical carcinoma is reducing and decreased, especially in developed countries. So it is not the most common malignancy in women worldwide, okay? But most cases occur in the developing world. This is right, yes, because not all developing countries use the screening program for cervical carcinoma. Okay, next question. How cervical cancer be prevented? How cervical cancer be prevented? A. Treatment of infection. B. Healthy diet. C. Exercise. D. Avoiding contraceptive pills. E. Human papillomavirus vaccine. Please choose the one best response and try to answer before me and give yourself a score 1 mark for each question. At the end, write the total score in a comment out of 10. Okay, the best one response here is human papillomavirus vaccine. Yes, it can prevent. Yes, as regard, if you are searching for the most important risk factor or etiology for cervical carcinoma, you will find infection with human papillomavirus. So using human papillomavirus vaccine give us the opportunity to decrease the occurrence of cervical carcinoma. So yes, human papillomavirus can prevent cervical carcinoma. Human papillomavirus vaccine, vaccine, we know that there is vaccine called Gardasil and another one called Cervarix. It is given at the school age in 2 doses. So human papillomavirus vaccine can prevent cervical carcinoma through its role in avoiding infection of human papillomavirus, or decrease the persistent human papillomavirus or recurrence of human papillomavirus infection. Okay, let us go to the next question. Which one of the following is true about human papillomavirus infection in women? Again, which one of the following is true about human papillomavirus infection in women? A. Human papillomavirus DNA is found in about 40% of squamous cervical cancer. B. Peak prevalence is in women aged 20 up to 30 years. C. Infection is usually persistent. D. There is no vaccine for human papillomavirus. E. Most women will go on to develop genital warts or cervical cancer. Please choose the one best response and try to answer before me, and give yourself 1 mark for each question. And at the end, write the total score in a comment out of 10. Okay, the best one response here is peak prevalence is in a woman aged between 20 to up to 30 years. Why I choose this answer? Peak prevalence is in women aged 20 up to 30 years. Okay, because A. Human papillomavirus DNA is found in about 40% of squamous cervical cancer is not true. It is more commoner than that, than this percentage, up to 90% maybe. So 40% is lower, is not true, because it may reach up to 90% of, or maybe more, of squamous cervical cancer. Okay? So this is false. Infection is usually persistent is also false. It's not true, because spontaneous resolution happen usually, especially in young age. Young women can clear infection completely within 8 months. So infection is not usually persistent. So this statement is false. The next one, there is no vaccine for human papillomavirus. I just said now that there is 2 vaccines for human papillomavirus, like Cervarix or Gardasil. The last statement, most women will go on to develop genital warts or cervical cancer. This is not true, because most women will resolve spontaneously from human papillomavirus, not develop genital wart or cervical cancer. Only who develop genital warts or cervical cancer are those with serotypes. Genital warts for serotypes, for example, human papillomavirus genotype 6 and 11. And to give genital warts needs many factors to develop genital warts, not only being 6 and 11, lowered immunity, persistent infection, and so on and so on. And the same for cervical cancer, but the serotypes here, the commonest is human papillomavirus 16 and 18, which develop cancer, okay, or CIN. So this statement, most women will go on to develop genital wart or cervical cancer, is not true. Most women will resolve spontaneously, okay. So the best one response here is peak prevalence is in women aged 20 to 30. This age is the commonest, yes, for human papillomavirus infection. Sexually active women. Okay. Let us go to the next. A 29-year-old second gravida, second bara woman underwent examination with colposcopy. A distinct cervical aceto-white area is noted with coarse mosaic and punctation. This result is consistent with which histopathologic finding on directed biopsy. Again, a 29-year-old woman, second gravida, second bara, underwent examination with colposcopy. A distinct cervical aceto-white area is noted with coarse mosaic and punctation. This result is consistent with which histopathologic finding on directed biopsy. A. Atrophy. B. Invasive squamous cancer. C. CIN2 or CIN3. D. CIN1. E. Chronic inflammation. This result is consistent with which histopathologic finding on directed biopsy. Please choose the one best response and try to answer before me. Okay? The best one response here, as regard there is coarse mosaic and punctation and distinct cervical aceto-white area. This is criteria of measured degree like CIN2 or CIN3. So the best one response here is CIN2 or CIN3 because of the coarse mosaic and punctation and dense aceto-white. Okay? This is the best one response. Okay, let us go to the next. A 37-year-old woman, third gravida, third bara, underwent pap smear screening test. The result reveals high-grade squamous interepithelial lesion. What is the next step in management? Again, 37-year-old woman, third gravida, third bara, underwent pap smear screening test. The result reveals high-grade squamous interepithelial lesion. What is the next step in management? A. Hysterectomy. B. Colposcopy and biopsy. C. VIA test, visual inspection acetic acid test. D. Human papillomavirus test. Sorry. What is the best one response? Okay. She has a high-grade squamous intraepithelial lesion as a result from the pap smear screening test. Of course, so I'm not going to do a hysterectomy. Yes, I'm going to do colposcopy and biopsy from suspicious area to confirm the pathology, okay? Or to prove the pathology. Colposcopy and take biopsy from suspicious area. Of course, I'm not going to do VIA test because it will not help me anymore, or human papillomavirus test will not add to me some important information, but colposcopy and the taking biopsy from suspicious area is the best one response here. Of course, the biopsy will be sent for histopathological evaluation. So this is the sure diagnosis. You take a biopsy under the guide of colposcopy from the suspicious area. Histopathological evaluation will give me the diagnosis. Okay? So the best one response here is colposcopy and biopsy. Next question. Colposcopy gives a chance to do which of the following? Colposcopy gives a chance to do which of the following? A. Treat microinvasive cancer. B. Diagnose cervical cancer. C. Inspect the entire transformation zone in all women. D. Choose the most suspicious area on the cervix to biopsy. E. Visualize the endocervical canal. Please choose the one best response. And please try to answer before me and give yourself a score, 1 for each question, and at the end 10 questions. So tell me your score on a comment on this video out of 10. Okay, everybody, choose the one best response. The one best response here is choose the most suspicious area on the cervix to biopsy. D. The best one response is D. Choose the most suspicious area on the cervix to biopsy. Of course, colposcopy is not used as a treatment for microinvasive cancer. This is false. Diagnose cervical cancer, not only with colposcopy, just okay. Inspect the entire transformation zone in all women. You may say this is the right answer also. But here, inspect the entire transformation zone in all women is not accessible because transformation zone has 3 types: type 1, type 2, and type 3. Type 3, where the upper limit in the endocervical canal cannot be visualized. So in some women, you can't see the whole transformation zone. And even in postmenopausal lady, the squamocolumnar junction inside the cervical canal, maybe you can't see even the squamocolumnar junction or transformation zone in some postmenopausal women. So you can't guarantee in all women. So please write each word with concentration, because here, yes, I am inspecting the transformation zone using colposcopy. This is right. But not entire transformation zone can be seen on all women. So this is why I didn't choose this one. But I choose D, choose the most suspicious area on the cervix to take biopsy. Yes, this is the main target of colposcopy, to take biopsy from most suspicious area on the cervix. Okay? After you apply acetic acid and you see the most suspicious area, before acetic acid and after acetic acid, you can choose the acetyl white area where the site you should take a biopsy and send for histopathology. This is the main target of colposcopy, by the way. Why I didn't choose E, visualize the endocervical canal? Of course, colposcopy cannot visualize the whole length of the endocervical canal, of course. It is not accessible. So it is false. So the best one response here is D, choose the most suspicious area on the cervix to biopsy. This is the end of this multiple choice question. Please write your score out of 10 in a comment and try to answer all questions before me. Okay? This is my 5 books published on Amazon: textbook of obstetrics, textbook of gynecology, contraception handbook, and the multiple choice question book, and the medical disorder in pregnancy. This is the last published book on Amazon. my site on Amazon here. You can go to my site on Amazon and find my box. This is my YouTube channel link, and this is my link on Blogspot. Thank you, everybody. My best wishes for all of you.